when you're ready.
Okay. Have any of you ever seen a family member or a close relative suffer and die of cancer or other progressive illness? After their passing, have you ever heard your family or relatives say, "I don't want to suffer like that, just put me out of my misery"? Isn't something natural after you experience something horrific? This brings up the topic of physician-assisted suicide. What is physician-assisted suicide? It is not euthanasia. Euthanasia is when a doctor physically gives the patient the drug, like the lethal injection, or you think of putting your animals to sleep. That's euthanasia. Physician-assisted suicide is where the doctor provides the means for death via prescription, and then the patient will take it themselves on their own free will. I'm sure all of you are thinking of a famous doctor called Dr. Kevorkian. He's the one who started this. His patient suffered from Lou Gehrig's disease, ALS. It's a disease in which your nerve cells attack it attacks your nerve cells responsible for your voluntary muscles. So in the final stages of Lou Gehrig's, which his patient was, you can't move, you can't breathe, you can't speak. So you're basically bedridden with a breathing tube and a feeding tube, but you're fully there in your mind. So it's like being in a little prison in your own body. And he's right now serving a 25-year prison sentence. Did you know that physician-assisted suicide is legal in Belgium, Germany, Luxembourg, the Netherlands, and Switzerland? In addition, euthanasia is legal in the Netherlands and Luxembourg. Did you also know that in a survey, most members of the public will agree that PAS is ethically justifiable in certain cases, and most of them involve unrelenting suffering? The problem? It is illegal in every state in the United States except for Oregon, but it is legal in Oregon. The cons of physician-assisted suicide: it's a violation of the Hippocratic Oath, which all doctors take. It has potential to be abused. Doctors can give up on patients too soon, and doctors are given a lot of power. Pros: it can relieve pain and suffering. Patients can die with dignity rather than being ravished by their disease, such as the ALS. You can't do anything. Your diaper is being changed, you're being fed, you're completely helpless. It will free up doctors and health insurance time and money to help those with curable illnesses. And patients will refrain from committing more horrific forms of suicide. Can physician-assisted suicide be legal in the US? Well, as we know, it's legal in Oregon. But I interviewed a lawyer, and he said that it would be unlikely for a statute to be passed prohibiting it, but the consequences would be you'd be convicted of homicide. More legal issues. He also said that potentially there's a Right to Privacy Act under the federal constitution, which could possibly be used. Maybe that's how Oregon did it. One doctor's stance: I interviewed a doctor. She said that assisting a patient in suicide is direct violation of her Hippocratic Oath, and she would not do it. But she said, "I feel once you have reached a certain age and have a certain degree of a known illness which has a definite and known course, that we should refrain from extensive life-saving measures, letting nature run its course rather than drug-induced death." The solution? Legalizing physician-assisted suicide with regulations. For example, perhaps two doctors should agree that this patient is suffering from a terminal illness and that physician-assisted suicide is reasonable. Patients should be evaluated by psychiatrists to make sure that they're completely of sound mind. A witness testimonial that the euthanasia of the patient was not pressure or forced in any way, it was completely willing. And grief counseling for the family. Benefits of this: we would relieve suffering. Patients can die with dignity. Health insurance money can be used on those with curable illnesses. And doctors are freed up to help those with curable illnesses. And it would be regulated. This isn't about giving up. It's about when you're in your final days and you know you're going to die and you're suffering and your family's suffering. And if you want an out, you should have a right what you want to do with your life.